Okay. All right. Hi, everybody. So thank you so much for joining us for episode 1 of the podcast, aka the Filipinex AO Sharing Stories Together. So today is Friday, April 30th. It's 10:30 a.m. Pacific time. So thank you for joining us. As I said earlier, we are so grateful to have everyone here speaking upon the topic of COVID-19 vaccines and general information. So my name is Arlia Aguilar. I'm the project coordinator for the podcast. And today I am here as one of the internal hosts. So I would like to introduce our two guests today. One is the external host, Rochelle Ocampo, and the other is our wonderful guest speaker, Dr. Carlos Arance, but I'll have them introduce themselves and talk a little bit about themselves. So Rochelle, would you like to go first?
Sure. So excited to join this podcast and group. I am Rochelle Ocampo, and I currently lead public health initiatives through special events, fundraising, and communications at a community health center in New York City. So this is where I'm based at in the East Coast. I am also a producer and lead host of Maquilada TV, which is the first and now longest running Film TV talk show in the New York metro area, and also involved with NAFA, Raise Panay, Roots of Health, PhilPro, and UniPro. And lastly, I am a new mommy to 10-month-old Alexander.
Thank you so much, Rochelle. We're so grateful to have you today as one of our external hosts. It's already been a pleasure working with you, and we're very excited to have you here. So next, I'd like to introduce our wonderful guest speaker and one of our own PhilCha members and officer members, Carlos Arance.
Hey everyone, I'm Carlos Arance. I'm a postdoctoral fellow in health services research and public health at UCLA. I'm also a primary care physician. Originally from the DC suburbs in Virginia, also the president-elect of PhilCha, and really excited to be here today to talk on a really important topic.
Yes, thank you so much, Carlos. We're so grateful to have you, and it's a pleasure having you as our guest speaker, especially both with your background as well as your affiliation with PhilCha. So thank you so much for being present, and thank you both for taking time to be here. We're excited to share and talk about a very important topic, especially one not just affecting our Filipinex AO community, but also the greater world. It's a very important topic for everyone to know, and I think anyone can benefit from this. But we are going to take a spin on the topic and focus on important information that our community, the Filipinex AO community, really needs to know. But as I mentioned, this is also general information that's pertinent to anyone who's interested in learning and listening. So before we do begin the interview portion of our podcast, I would like to give a big thank you to the Association of Asian Pacific Community Health Organizations, aka APCHO. They have been helping us with so much through collaborative work, and we're so grateful to have them supporting us through this podcast. Also wanted to say thank you and to our generous supporters who help partially fund this podcast, the Walmart Foundation. So thank you to those two entities. So today, as we mentioned, it is episode 1 of the COVID-19 series for the Filipinex AO Sharing Stories Together podcast. Last week, we did have our pilot episode where we introduced our internal hosts, talked a bit about who PhilCha is, which is the organization who houses the podcast, as well as just really important information regarding how we chose our name and just background and history of our PhilCha and podcast. So today we're going to be talking about COVID-19 vaccine and just general information that's important for the Filipinex AO community to know. And to kind of connect this, it's a really great way to start the podcast series. 1, vaccine rollout is happening currently for COVID-19. 2, our community, we will learn how we are affected, why it's important for us to get vaccinated as individuals and as a community. And 3, our organization, PhilCha, actually started because of COVID-19. And so it was a great way to kind of kickstart the series for the podcast. So I am going to pass on the mic to our wonderful external host as she's going to start off the interview with Carlos, with our first topic being the Filipinex AO community and how COVID-19 has affected us. So Rochelle, please take it away.
Yes, thank you, Arlia, for sharing the background information on. I still giggle every time you say because I'm like looking over my shoulder if someone is really hollering at us. But thank you so much for giving that background info and for Philcha as well. So let's get right into it. There's so much information out there on COVID, and honestly, it's super overwhelming, sad, and very stressful. So, Carlos, can you tell us, are we as Filipinos disproportionately affected by COVID-19?
Yeah, that's a great question to start off with. And I think when we sort of look at disproportionately impacted by COVID-19, I kind of want to break that down sort of in two ways. So when we think about how COVID has affected people, sort of from a clinical and medical perspective, one way of looking at it is, do people die from severe COVID? And then do people also contract COVID at higher rates, compared to other groups? And so on that first kind of way of looking at it, mortality, Filipino Americans, Filipinx Americans, Filipinas are experiencing COVID-19 deaths at a much higher rate relative to their size in the general population. Now, the information on this is really, really slim. It's hard to come by. Some of the data is hidden because of privacy concerns. But looking at the state of Hawaii, for example, as of last week, they were able to report disaggregated data. So data for each specific ethnic subgroup within the category of Asian. And what they found is that Filipinos comprise 22% of deaths from COVID-19, despite comprising 16% of the population there. And in some of the data that's been recently available in California, for example, of Asians who have died from COVID and those that are between the ages of 18 and 64, 42% were Filipino. No other group within the Asian category has comprised a larger share of COVID-19 deaths within the Asian category here in California. And so that sort of then leads us to the question of, well, why is that? And I think that, there are certain chronic conditions, things like hypertension, just to plug, Alex Adia, one of our members, had a paper that showed that Filipinos in California were 3 times more likely to have hypertension and 2 times more likely to have diabetes. And these are conditions that are associated with worse outcomes. I won't go too far into it, but when we then sort of ask the next question, well, why is that? Why are these conditions more common? That sort of leads to, looking at what I call sort of the social determinants or structural determinants, sort of the history of how Filipino immigrants came to the United States, their experiences in the Philippines, and sort of what jobs are available, and all of those things, chronic stress, all of that kind of contributes to a lot of these chronic conditions that our community experiences at higher rates. And then sort of the second point about transmission or being able to contract it, one of the most important things is looking at exposure related to jobs. So where do Filipinos, Filipinas, Filipinx Americans work? And so, 1 in 4 working adults that are Filipino are frontline healthcare workers. And so, another plug for Kanlungan.net, which was started by the Affirm organization, but they have, in a really poignant way, paid tribute to all of the Filipino healthcare workers worldwide that have fallen to COVID-19. And you only have to look at, other websites like The Guardian to see that healthcare workers are disproportionately, Filipino healthcare workers are disproportionately affected. And then sort of one last, I think, kind of statistic on this is that the National Nurses United Union had a report last fall that basically showed that 32% of COVID deaths among nurses were Filipino, despite, comprising 4% of the population. And so those were really startling numbers for us. And then one last factor is the multi-gen households. And a lot of folks in our community, we live with our lolos, we're the primary caregivers. And, if 1 in 4 Filipino working adults are healthcare workers, but they also take care of family members, it's no surprise that our community is experiencing a much higher rate of contracting COVID and dying from it. So I think all of those things together really painfully illustrate that our community is disproportionately affected.
Oh, absolutely. I mean, I'm thinking of my family, my own family, and I can see why it's so important for us to really take these precautions more seriously, especially if we're in a multi-generational household. It's not just our grandparents, but also like our titas and titos that are living in our same house with our kids and grandkids. So it's really it makes sense that it's disproportionately affecting us. So in terms of like, what can we do? Like, this is really startling data that I feel like that really needs to be promoted more. We know that there are 3 available safe and effective vaccines in the US, all with 100% in preventing hospitalizations and death. What are some other ways that we can protect ourselves on top of getting the vaccine, and also to protect our families?
Yeah, so this sort of speaks to the importance of, what we call non-pharmaceutical interventions. I mean, it's just a fancy way of saying the things that we've known since the beginning of the pandemic, which are sort of the 3 W's. So wash your hands, wash your distance, so physical distancing, and 3, wear a mask. So the 3 W's: wash your hands, wash your distance, wear a face covering. And these have all been borne out in data. So like epidemiologists, academics, public health people, we've sort of tracked this over time and see how people's behaviors sort of curb the spread of the virus. And each of those kind of speaks to potential ways that the virus spreads. So, droplets in the air, washing your hands frequently so that you're not touching your nose and touching your eyes. And the effect of this has effects elsewhere. I mean, the flu season has wrapped up, and it was the lowest rates of flu that we've seen in years. And I think that speaks to the power of these kinds of interventions. So just simply washing your hands, wearing a mask, maintaining a safe distance. Right now, the guidance for distancing is about 6 feet. There's also more and more evidence, so more and more studies from around the globe that shows that maybe 3 feet might also be just as good. But right now, 6 feet is sort of the maximum or the minimal distance that we want to maintain when we're around folks that we don't know who are vaccinated, for example, and out in public. And I think as so many other people have talked about, we're not out of the woods yet. The vaccines are here, but in LA, for example, only 30% of the population has received the vaccine. And so it underscores that we cannot sort of let our guard down, that we have to continue to do these safe measures because it's not an on-off switch. It's just sort of, as the risk gradually goes down, then we can start to adjust some of those behaviors.
Yeah, I mean, I feel like that I'm seeing people more comfortable not wearing masks outside, like in public areas. And the CDC is providing new guidelines every other day, so it's hard to keep up of like what is safe and what's not safe, especially now that people are getting more people are getting vaccinated. So how do you think that, what's your message to people who are already vaccinated and now starting to feel like a little bit more comfortable without a mask?
Yeah, so I'd like to point people to the CDC's website, the Centers for Disease Control, because they have this really helpful chart that breaks it down based on the type of activities that one is kind of taking part in. And so I think about it in the same way. You have indoor activities and you have outdoor activities. And the messaging has been sort of consistent that it's really indoor activities that are the focal point of transmission. So that's where a lot of COVID spreading has happened. And so if we're in an outdoor area, there's ventilation, there's air. If somebody coughs or sneezes, the wind quickly removes those particles from being able to be inhaled by someone else. And so if you're in a public space outdoors, the current CDC guidance is that you don't need to wear a mask. That's not to say don't wear a mask. You know, if your level of comfort is, you know, I want to wear a mask, that's totally okay. You know, if you're outside exercising and you're vaccinated, it's okay to not wear a mask, because, you know, as long as you're maintaining distance, those chance encounters passing by someone are so small. And you can have outdoor activities with people, and you can spend time outdoors with people who are unvaccinated, again, maintaining a physical distance. And even now with dining, outdoor dining, that's permissible to not wear a mask if you're vaccinated when you're outdoor dining. I think the thing that concerns me is like a concert. Like if people were getting together for a concert, like even if you're vaccinated, I think that you should still wear a mask, and that's consistent with what the CDC says. And it's because, you know, if people are all crowded together, just sort of the increasing risk of being so close to other people kind of piles up that you have to wear a mask. So
yeah, you were mentioning about like outdoor gatherings. It reminds me that you know, one of the most disappointing things about giving birth in the middle of a pandemic is that I felt robbed of huge celebrations to welcome this new beautiful life into this world. So I personally thrive in like group-oriented settings, and so do many Filipinos.
absolutely.
Who are typically family-oriented and have like a collectivist mentality. How do we safely congregate or stay safe in general during COVID? So you're saying just make sure that even if you are vaccinated, still wear a mask if you're in big groups indoors. But outdoors, we could play it safe by, you know, just maintaining distance without mask.
Yeah. I think with the outdoor situation, when you're with family members, I would err on the side of caution if you're not sure of somebody's vaccination status. And I think if you're outdoors though, and you're with another household, like other family members, and everyone is vaccinated, it's okay to not wear a mask. You know, the effectiveness of the vaccines shows that they reduce severe COVID, that they reduce even symptomatic COVID rates, and then increasing evidence that even asymptomatic transmission is also blunted by the impact of the vaccine. So I think it's really important though to know sort of your family and also know your level of risk. And risk isn't, you know, black or white. There are shades of gray. And, you know, if you're around family members who have certain conditions that make it easier to get really bad COVID, and they're not vaccinated, you know, it may not be the best thing to have them sort of around others. But at the same time, like, these are also decisions that one needs to make sort of based on their own kind of comfort level.
Yeah, I think that's really important to remember is, you know, everything is a risk. It's just up to you as an individual or as a part of the family to decide that, you know. And yeah, I feel like that the next party is going to be my backyard. I'm going to ask everyone for their vaccine card as a entry fee. And yeah, you're all welcome next time you guys are in the East Coast. Come by.
Nice.
So we were talking a lot about vaccines. I feel like that's like really the hot topic now. I wanted to just like transition into that and see if Erlia, if you can lead the conversation of vaccines.
Yeah, well, thank you so much, Carlos, for this really great summary and explanation of COVID-19. And, I think referring to the CDC is one of the best, for sure, resources that we can consult to, especially because, as Rochelle had said, there's so many changing information consistently every day. Like, I know there's information about J&J vaccine, and it went from being recalled to being verified as being okay to use again, right? So I'm glad that you referenced the CDC. And I meant to say this earlier, but I do want to make a quick disclaimer for those watching that, as Rochelle has mentioned, and Carlos also has mentioned, information consistently changes. So as of Friday, April 30th, this information is up to date, but for all we know tomorrow, something can change. So I think that's one of the things that's really important to acknowledge, right, is the consistent change that's occurring. So we're really grateful to have Carlos here today with us to talk about everything up to date currently. We will have other episodes, and this series is going to be focusing on COVID-19. So, for future episodes, we'll talk about misinformation, we'll talk about school rollout, and we did try to strategically plan these episodes to fall into place when we found it appropriately. So as things change, we hope to also update you all on that, but CDC is a perfect place to look. So thank you for referencing that, Carlos. But yeah, so as we've been talking about COVID-19, how it affects the general community, how it affects our specific Filipinx AO community, I think it's a good transition to talk a little bit about vaccines. So I think, there's plenty of different surveys and questionnaires that have been taken. I know Tayo Help Desk is one of the resources that's a big advocate for doing surveys and asking questions about how the community feels about issues regarding COVID-19. And I know how certain communities have, and when I say communities, I mean within our own community, so different populations, elderly communities, healthcare workers, just within our own population of Filipinx AOs, had some concerns, especially as a marginalized community, regarding the speed of the vaccine rollout. So one of the questions is, what should the community understand about the vaccine, and how the vaccine's safety and how the study behind the vaccine has been implemented? So Carlos, if you have any input on that, it'd be really great, because I think that's something that we have seen through those surveys that people are concerned about in regards to receiving the COVID-19 vaccine.
Yeah. So all new medications or treatments in the United States go through a really rigorous process where you first see, does this medication or new therapy, or in this case, the vaccine, does it work in sort of a test tube with certain cells? Then it's tested in humans to see if it is safe. So we gave it to someone in a really controlled setting. We looked to see if there was anything bad that happened afterwards. There might be some side effects, some soreness in the injection site, but overall, nothing that would cause us to sort of pump the brakes. And then once we know it's safe, then we want to know, does it work or not? So first we determine whether it's safe, then we determine whether it actually does what it's supposed to do. And that's where those large clinical trials take place. And so for the vaccines, tens of thousands of people participated in the vaccine trials over the past year. So Pfizer and Moderna, two of the vaccine companies, 70,000 people took part in those trials. And there was very good diversity of patients that were there. I believe, just sort of off the top of my head, about a quarter of patients in the Pfizer trial were Latinx, for example. And I believe in the Pfizer trial, they also did very good outreach in partnership with communities through medical centers to sort of discuss the myths of vaccines, why it's important to participate in a trial, to make sure that people in your community are also involved in developing these new therapies. And so when we look at sort of when all of this started last year to now, I don't think it's unreasonable to have concerns. I think it's totally appropriate to have concerns that, why did this happen so fast? And And the reason why it happened so fast is with the pandemic, everyone worldwide was panicking. If you remember, we're all stuck at home. Everyone stopped doing anything, including the scientists. They stopped working on all their projects, and they, directed their energy to working on vaccines and vaccine technology. And that's sort of a beautiful thing that humanity is trying to kind of come together. The scientists have all come together to try to make the process work faster. And then the technology itself. So the mRNA technology is actually about 10 years old. And so this is not technology that was just sort of just came out of thin air. It was something that's been investigated and developed. It's just now we really had the tools to be able to scale it up. And then when it goes through the trial, there's also a data and safety board that makes sure that nothing bad is happening to people who are participating in the trial. And then it goes finally through the FDA. And so that's sort of what brings us to this point.
Got it. Well, yes. And, I think it's so helpful to hear that from especially someone with your expert background, because I think a lot of the times, misinformation is easily spread, especially in this day and age with technology and the internet. It's a very great resource, but it's definitely hard to filter through what is the reality of what's going on. So I think hearing this is really helpful. And I'm hoping that the audience is also really learning a lot from this, because I know I'm learning so much from this conversation. So it does sound like, this vaccine, I think for me, having learned all this, it really warms my heart to know how when we can come together as a community, not just within the Philippine XAO community, not just within the United States, but as you mentioned, like worldwide, this is the definition of a pandemic, right? It's a worldwide, it's affecting the world. And so knowing that individuals coming together, and that's a part of the reason to why we were able to make this happen in the span of time that we did. It's both inspiring and more heartwarming to know. And also acknowledging, the transitions on how this wasn't just something that we just threw together just for the sake of needing to. It was really a bunch of different brains and different procedures and steps. So thank you for sharing that with us. That was very helpful to know. And hopefully people out there who had some hesitancies for getting the vaccine because they were unsure, hopefully this gives them a bit of clarity and comfort. So thank you for that.
Yeah. I think one other thing is, I think a lot of people are also kind of taking pause when they make a decision to get a vaccine, and they really want to know more about the vaccine. And I highly encourage folks to look up information from say the CDC. And a lot of the times it's just sort of a slow yes is how I've heard it described, that it's not that people don't want the vaccine, it's just they want to learn more. And I think that's absolutely okay. That's totally okay. It's sort of a slow process of learning more and more, seeing more and more of your friends get the vaccine, that they didn't experience anything beyond the predictable side effects. And so as long as people out there are having those conversations with their friends, and I think that kind of helps get rid of like this mystery around this new technology. And I think it'll make it easier for all of us, especially those that are younger to get the vaccine.
Yeah, I'd also like to add that, we as people who have received the vaccine are and should be ambassadors. Like we should be really being out there to advocate for why it's so important to have a vaccine and tell our own stories of, how it affected us and our family members. Some people didn't have any reaction. Some people felt like that they got hit by a bus. Like it's like it ranges, but in the end, they're now safer. So yes, I definitely feel like that it's important to advocate for that as people who have experienced it ourselves.
Definitely, yeah. I know as someone who's a pre-med currently, this is something that I talk within my pre-med friends or pre-health friends, but I really appreciate that, people beyond my circle of pre-health individuals are talking about the vaccine more. It really is great to see everyone kind of being ambassadors, as Rochelle said, for this vaccine, like unofficially, and sharing their stories, because I think it normalizes the conversation. And, I think as someone who's a pre-health, I kind of have this bubble where I think everyone knows what's going on naturally. But then when I talk to my friends outside of that sphere, they're like, oh, you got reactions. Oh my goodness. Like I thought that something was going on with me. So I think it's great that we're definitely normalizing the conversation and hopefully encouraging individuals to do that as well if they haven't. So thank you both for that perspective. So I think, we're talking more a bit general about the vaccine. So the next question that I kind of have is in regards to specifically, why is it important that Filipinx AO individuals get the vaccine, not just for themselves, but also for the community? We kind of touched upon this when we talked about if Filipinx AOs are disproportionately affected by COVID, but I think kind of tying that back to vaccines. So Carlos, if you don't mind answering that question.
Yeah. So great question. I think there are two ways of looking at it. When we take medication in our everyday life, we think about it from how does this make me feel better, or how does this help me? And one of the difficulties as a primary care physician is trying to convince folks of the importance of something that is going to prevent something in the future. And so I think with the COVID-19 vaccine, what we're doing at an individual level, so just each person who makes the decision to receive the vaccine, for yourself, you're protecting yourself. I think the trials had really, really amazing evidence of effectiveness. And to get into the weeds of that, because I think people really care, well, what does effective really mean? For those vaccines, the way that they measured whether they worked or not was whether they prevented severe COVID. So severe COVID includes shortness of breath. It includes having a low oxygen level. COVID-19 for many, many people is an upper respiratory infection that will go down to sort of the throat and cause flu-like symptoms. But for the people who get really severe COVID, it goes down further into the lungs, and that's what leads to having shortness of breath, like you feel winded, and then low enough oxygen that you have to go to the hospital and receive oxygen treatment. And so those situations, they were much, much lower in the group that received the vaccine. So the effectiveness was around 95% for many of the vaccines that are out there. And so the curve of people who are getting severe COVID versus those who weren't in those trials was just huge. There was a huge difference. And so with COVID-19 right now, the chance of getting hospitalized is let's say for every 1 million people who have a COVID-19 infection, about 70,000 of them will have hospitalizations. About 15,000 of those 1 million will pass away, unfortunately, from COVID-19. Now, if you took 1 million people who had the COVID-19 vaccine, that changes dramatically. Only 1 to 2 people will become hospitalized from COVID, and about 1 to 2 people will pass away from COVID if you get the vaccine. So in that group of people who gets the vaccine and then develops COVID-19, which is extremely rare because of how effective they are. So I think there's the individual protecting myself, but then the other really, really important thing is protecting your family and protecting our community. Rochelle, you mentioned how one of the things that was so hard was not being able to celebrate such a momentous life occasion because of COVID-19. And I think if being able to protect yourself doesn't move you, then maybe it's that we need to appeal to the fact that we love parties, we love celebrating, we love getting together. And with the COVID-19 vaccine, that makes it possible. It's sort of a ray of hope. I mean, we all sort of miss those family parties where, all the titas are line dancing. We miss, seeing our lolos and lolas, eating pancit, eating lumpia, having those conversations, catching up with our cousins, celebrating those occasions. You know, we haven't been able to do that for the past year. And that's sort of central to like who we are. And so I think the vaccine is so critically important for us to be able to resume those activities. I mean, the guidance right now is that households that are completely vaccinated can get together. And so that's sort of a huge ray of hope right now that families can start to get together. So I hope that answers your question.
It's so amazing that you just brought it up, because I was just thinking of what happened a few days ago. My parents are now 2 weeks after their second Moderna dose, and it has been now 300 days since my son been born, and they were finally able to kiss him, like kiss and hug him. So it's so important to just realize how much this has changed over just a couple of months, that you get to hug and kiss your family members after they get vaccinated. So it's not just about gathering, it's about like being showing that emotional love, physical love, that you're not able to have done it if you didn't have the vaccine. Sorry, getting emotional.
No, absolutely. I mean, like, yeah, for like, yeah, exactly. For that situation, I mean, your child got to meet their Lolo and Lola for the first time, and how powerful is that, and how critically important that is for all of us to be able to physically touch our family members, and hug them, and receive hand blessings, and that sort of thing. That's I think what the vaccine really means for our community, is to be able to come together in the ways that we're so used to, and being able to share our love and our stories together.
Right, definitely. And I think, as we talked about earlier, we tend to be family oriented. We tend to have that collectivist mentality as Filipinos and as Asian Americans. And so, I know personally for me, 2020 was a big year for my whole family. My Lola turned 90. I had cousins who were pregnant, having kids. My parents, I won't share their age out publicly, but they hit a milestone birthday. My sister was going to graduate college. So there's so many big milestones that was supposed to happen in 2020. And, it's unfortunate that it couldn't happen then, but I'm hoping 1 year later with the vaccine, we don't have to wait longer, and we can do those celebrations. And, everything was postponed. I mean, you can't necessarily postpone grads and birthdays, but to be able to celebrate together again, and to meet my nieces and nephews that were born, it's been so great to be able to have that opportunity because of the vaccine. So I appreciate both of you all for sharing, for being raw and open, and just really being honest and genuine about the stories. I think this is exactly what we want this podcast to be. It's not just the data, it's not just the facts, it's also humanizing the stories and sharing personal perspectives of how this has affected us. So I think this is really, warms my heart to see us coming together and having these discussions. So thank you both. Since we're talking about the importance of the vaccine, how that helps us, I think my follow-up question then is, what should people expect then? What are the normal reactions that people have? I know we kind of talked about that there are some symptoms that could arise. So what does that look like? And, how do people navigate the process of scheduling a vaccine? I know it's kind of different per state, per location, but just kind of expectations. Because I know some people in our Philcha space have expressed some people have to drive hours to go get the vaccine. Some people don't even know when to check or where to go looking to begin with. So I think that's a good kind of transition over to expectations for the vaccine. So
yeah. So when one gets the vaccine, I'll talk briefly about the side effects or what to expect. So the most common thing is pain, local pain. So, a little bit of soreness lasts a day or two. I think in the Moderna trial, about 90% of people who received the vaccine reported having some local pain, and I think about 75% for the Pfizer trial. There's also some redness that also happens at the site. I think very commonly, something like 2/3 of people in the Moderna trial experience muscle aches. So just feeling like you worked out really hard and feeling tired. Um, and that's usually after the second dose. So after I got my first dose, I had a little bit of pain, a little bit of soreness, and it went away by the next day. After the second dose, I thought I was in the clear on the second day. I was like, okay, this is fine. I've heard some things. And then like 18 hours after the second dose, I felt like I got hit by a truck, and I was like trying to do work. I was sitting on my couch and I was like, I'm just gonna lie down. I'm really, really tired. So, I mean, that's really common. Rochelle, did you experience anything?
Fortunately, not as severe. After the second dose, I just had chills like, at the night before,
Mhm.
or the night of, sorry, and I just felt tired. So I knew that I wasn't gonna do anything that day, the next day. So I planned like just to veg out, and which was great.
Mhm.
So I just relaxed at home.
Yeah, and I think that's something to plan for. You know, don't fill your day after the second dose with meetings. You probably won't be working very well. You might have some headaches, some chills. A very small portion of people also experience a fever. These are all anticipated. These are all like normal. Like when we think about how a vaccine works, it causes an immune response. It's basically training your body for a fight. And when your body fights a virus, it just turns on the temperature. And so that's why you get a fever. It's not because you were infected with COVID. It was because your body is training for that potential battle, and getting those antibodies made. And so that's some of the anticipated side effects. I've seen some things like people have like a little redness around the side that gets a little raised, and that'll last for a week. That wasn't in any of the trials, but we're starting to see that, and it has something to do with the immune response, and that's normal. It goes away, so I think that those side effects are totally predictable. If you take ibuprofen or Tylenol, that will help. I think there's some folks like will say that you can't take an ibuprofen after the second dose, or to try to prevent symptoms, and that it might make the vaccine not work as well. But that actually is a little bit of a myth. There's not much evidence for it, so I definitely think it's okay to take ibuprofen and Tylenol with that. Now, with the getting your vaccine itself, this like you said earlier, it's difficult sometimes. Like with Dodger Stadium here in LA, the lines were really, really long. Vaccines.gov has a search option, and so if you have a phone, smartphone, computer, or can ask relatives to help you out with it, vaccines.gov allows you to put in your zip code, and then it looks up a number of places. So you can get vaccinated at a pharmacy, so your neighborhood CVS, Vons, Rite Aid. It'll tell you what vaccines are available, what their stock looks like. Then the local departments of public health, so like LA County Department of Public Health, for example, will put on vaccination events, and they'll try to vaccinate as many people as possible. There are also clinics, community health centers that have vaccination sites available as well.
Great, thank you so much. I think that would be helpful. I know it's, as you mentioned earlier, so many different opportunities and information and resources everywhere that it can almost be overwhelming. So knowing kind of the more specific and useful options are very helpful to know. And I'm glad that you all both shared how the vaccine has affected you, because I know for me, I expected the fever and chills, but I was like exhausted after my second vaccine, and I was so surprised. I was like, what's going on with me? Like, I'm not usually this tired. Like, I'm baseline tired a lot, as people know me, I have this joke where I'm like, oh, I'm always tired. That's always Arlia. But for some reason, I was like depleted and I didn't realize. And thankfully, I talked to some people who got the vaccine. So I would have thought, I would have worried a bit. I'm like, what's going on with my body? But knowing that that was a normal thing, I think, funny enough, that was the thing I was most surprised. I had chills, I had the fever, I had arm pain, body aches, but for some reason, the exhaustion, I was like, what's going on? But talking about it again, normalizing it's really great. Well, symptoms aren't great, but it's comforting to know that it's not just you, or it's comforting to know that this is, what's going on and this is a normal part of the process. So
yeah, I mean,
thank you
I've
for
told
sharing
relatives, I've told relatives that if you feel like you got hit by a truck, that vaccine's working. Like it's working, your body is
Right.
training. If you feel like your lymph nodes on the side, that you got injected are swelling up,
Mhm.
those are the sites where the antibodies get made. So it's working.
Yeah.
Right. Yeah, that's a good
Like
point.
a message, another message is that, it only lasts like a few days, if not like just the day after, 2 days after, it's like a complete 180. You act as if like nothing happened.
Right, right.
Mhm.
I
Yeah.
forgot to bring up one point that I think is really important to acknowledge with the vaccines and their side effects, especially because it's been in the news, but the Johnson & Johnson vaccine. The clot thing is scary. So for those that don't know, the Johnson & Johnson vaccine, 6 million doses of it were distributed and administered up through early April. And about 6 people experienced a really large clot, and it was very serious. Excuse me. And so that's out of 6 million doses. And not to minimize the severity of it, it was very dangerous. But when we're thinking about our own individual risk and what we're willing to sort of tolerate, there are things that are associated with clots that we, kind of do regularly. Things like birth control, smoking. These are all other things that have a risk of clot. And so 6 and 6 million is really, really small.
Right. And thank you so much for addressing that, because I'm sure some people, were nervous to hear about that, and the fact that it was recalled and then all of a sudden good again. It is kind of scary how fast things change. But as you mentioned, the whole world is working towards all these different um, topics surrounding COVID. So hopefully that does ease people's minds. So thank you for addressing that. I think the last question regarding vaccines that we have, it's a bit long, but and I know it's a very subjective question, as well as you mentioned, when it comes to COVID and the vaccine, it's a very individual thing. Also something that needs to be discussed and comfortability reasons, but it's kind of a on each spectrum kind of question. One is, things are opening up again. Different places are starting to go back to full capacity. We're starting to do indoor activities, bigger events like concerts, Disneyland, all that's opening. So how safe is it for unvaccinated children, given that the vaccine right now is only for 16 and up? How is it safe? How safe is it for them to be going back to school? What's the recommendation for parents, especially given your background as a primary care provider? What would you recommend to maybe a patient? Again, I know it's very individualistic, but if you can give info. And then on the other spectrum, we have, what about vaccinated elderlies? Given that we know that 65 and up has a higher rate of disproportionate effects, and they're the most susceptible. How is it in regards to congregating vaccinated elderly? Because we have heard of different facilities like live-in elderly care home facilities that have been affected, and unfortunately a lot of people have passed because of it. So the two spectrums, what is the general advice? I know we talked a bit about CDC and all that, but given this specific example, what would be the general advice that you could give to people who are listening?
Yeah. So that's a huge question. I think with the kids, and so I'll just sort of say right away that I'm an adult primary care physician, so I don't treat kids. But looking at like the American Academy of Pediatrics, for example, they recommend that schools, it's safe for kids to go to school if the schools have mitigation policies in place. If they have done things like um, 3 feet physical distancing. 3 feet is what I've seen with some of the pediatric recommendations more recently, in terms of being able to space children out in the school. I think that a lot of it also depends on community level transmission. Within communities where COVID is at a high rate, and what we mean by a high rate is anything over 100 cases per 100,000 people over a 7-day period, that's considered high. So if you look at some of the maps on like New York Times, those will be like the super red spots. Those are high transmission places. And I believe the Academy of Pediatrics says that would be sort of the threshold of like, it wouldn't necessarily be safe to have kids in school. Now, there's a lot of debate around that, and it does get very tricky. But for what I would say to people who are parents, I think you have to make a decision that feels right for you and feels right with your risk and your level of risk. As we know that even though the risk of developing severe symptoms from COVID among children is really, 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 really low, those that have experienced hospitalizations, some of the scary stuff, were much more likely to be non-white children, coming from marginalized communities. And so that is very, very important to acknowledge and recognize, especially as we're kind of tackling some of the policies around school reopening. Like, what school districts have the resources to put in place some of those mitigation policies? Did they get enough funding to be able to accommodate some of the mitigation policies that are needed? So that's what I would definitely kind of say. It's going to be individual. It's going to be depending on the community. Now, with the vaccines, currently trials are underway for 12 to 16-year-olds. And that should be later this year. The ones for under 12 years of age, I don't think have started recruitment yet, but I'm not entirely sure. So we should have a better idea by the end of the year for children. Now, on the other end of the spectrum, you were mentioning for older adults. And was this related to, do you mind repeating sort of that part of the question again?
Yeah. And thank you for addressing the children portion. So on the other end of the spectrum, there's a question that was asked on the Facebook page regarding vaccinated elderly. So we talked about similar households. Background on this individual is that they own a care home and their whole entire facility and staff is vaccinated, but adult daycare for adults and elderly are reopening. And so this includes all different households pretty much. So how safe is it for vaccinated elderly, given that elderly do have a higher, rate of exposure, or not like rate of exposure, but, are more susceptible, I guess. How safe is it for vaccinated elderly? So on the other side of the spectrum.
Yeah. So I think one of the important things with older adults, with our elders and the vaccines, is knowing that they are just as effective. I believe that maybe the lowest that I saw with the group over age 65 was an effectiveness around 85% in some of the trials. So they work. And I think that if somebody who is over the age of 65 and lives in a facility where the other residents have all gotten vaccinated and they're going to an adult daycare center, I think that the CDC guidelines also apply here, that if you're vaccinated but you're around other unvaccinated people, it's totally okay to be in that same space, wear a mask, especially a mask that's sort of tight-fitting. But I think because of the vaccine, that the risk is much, much lower. And so for that individual, the risks of sort of being able to socialize and sort of meaningfully connect with people has to be sort of weighed against the extremely sort of minuscule risk of contracting COVID. That said, I mean, you can be around people and wear a mask, and that's a risk mitigation strategy as well. So I think for that question, I think more information is better because it allows that person to make a decision that's like right for what they value.
Right. Perfect. Well, thank you so much for addressing our questions about vaccines. We really appreciate the insight that you've shared, and sounds like a lot of it, just keeping up with information and doing what's most comfortable for the individual. So I'm going to pass on the questions to Rochelle as we close up our podcast. So Rochelle, do you have any other questions you'd like to ask Carlos?
Yeah, I mean, it's a great closing question. There's a question from John from Zoom. So other than the CDC webpage, do you suggest any good sources of accurate, up-to-date aggregated info, especially for the Filipinx AO community and like what you mentioned earlier about elders?
Yeah, that's a really, really good question. So, I think Tayo Help Desk is amazing. I really love, the work that they've been doing throughout the pandemic. A lot of it is vetted by experts. It goes through a review process. So I very much trust what Tayo Help Desk is putting out there. The other thing that I would recommend is translatecovid.org. It's from, I think, the UCLA Asian American Studies Center, but they have an FAQ on COVID vaccines and COVID information, and it's translated in Tagalog, as well as I think 12 other languages, and it's really, really good. Now, for those who have difficulty accessing the internet, for example, there are hotlines that one can call. So one is the National Asian Pacific Center on Aging. They have a hotline for Tagalog speakers and Filipino speakers. It's 1-800-593-8087. Monday, Wednesday, Friday, 8:30 to 1 p.m. Pacific time to learn more about the COVID vaccine.
And Carlos, will you be able to just put that on the chat just so that we can share it more easily to the audience? And we could also share that on Facebook as well.
Yeah, definitely. Thank you so much for sharing those resources. I think it's very helpful to kind of know trusted and vetted resources, especially internet. So useful, so helpful, but just never known nowadays. And having the option for a telephone line as well is very considerate and grateful as well. So thank you, Carlos. Well, Rochelle, are there any other questions that you have before we close out our podcast today?
I actually have 12 other questions that we don't have enough time. So my question is, where can we ask these follow-up questions? Because I do want to ask so many other things for Carlos. Is there somewhere that we can submit our questions so that you can help respond to them?
Yeah. Maybe if people want to reach out to me personally, carlos.oronce, ORONCE @gmail.com. You can also reach out to Philcha and the email there. Arlie, what's our email for org?
Yes, it's phil.community.health. The full word association @gmail.com. But if you go on Facebook, you can just click the email button and it will already populate it for you. And we can share this information on our Facebook page. And we are always open on our Facebook for you all to ask questions. We're hoping to do, Q&As and questions. We're going to be posting an option on the Facebook page, on our Instagram, which is @philxao_cha, as well as our Twitter. We'll be posting opportunities for people to ask follow-up questions, and we have plenty more podcast episodes to follow. So we'll be addressing different topics then, and people can join us and ask questions then as well. So yes, thank you so much, Rochelle, for asking that. As we wrap up today, I just wanted to say thank you again to Dr. Carlos Oronce for joining us, sharing his expert background and opinions. Again, these are opinions. So at the end of the day, it's opinions and facts, a lot of data, a lot of resources. As we mentioned, please take this with a grain of salt, as it's very important for you to discuss this with your loved ones, with your healthcare providers, and just doing what's best and right for you individually, as it is hard to kind of give individual advice to a bigger crowd. But yes, any final notes from Rochelle or Carlos before I close out our podcast?
Yeah, just wanted to say thank you to Carlos, and also watch out for our next episode, Asian American Hate Crimes Effects on the Philippine XAO Community, which is going to be on Saturday, May 15. Time is TBD, so definitely check out the Facebook for more updates.
Thank you both for having me. Really, really appreciate the time and space that we've shared here. And everyone go get your vaccine, vaccines.gov.
Yes, thank you so much, Carlos. We really appreciate it. As Rochelle mentioned, please be on the lookout on our Facebook page. Give us the like so that way you get notifications and can get updates on more opportunities. PhilChaw is a very new organization, as I mentioned in the pilot. We just started in December and we're already doing such great work, including this podcast. So please keep up to date on what we're working on, how you can get involved. And whenever you have questions, please feel free to reach out. So just wanted to say thank you again. Don't forget to follow us also on our social media, PhilXAO_Cha on Twitter and on Instagram, again, for updates and information. And please spread the word about this podcast, because we're not doing this just for the likes and just for the views. We're doing it because this is important information that it affects our community, and that's why we have this podcast. So thank you again to our wonderful guest speaker, Carlos Aronce, our wonderful external host, Rochelle Ocampo, and thank you to the audience and for our support from PhilChaw, APCHO, and the Walmart Foundation. Thank you, everyone, and have a great rest of your Friday.
Take care.
Bye.
Bye.
Thank you.